Hi, my name is Dr. Spickle, functional podiatrist and advisor for StepStrong. I'm going to take you through a 15-minute mobilization series that you want to do to help reduce any plantar fasciitis symptoms or pain that you're having at the bottom of the heel. Now, these 5 mobilization exercises that I show you, I do recommend doing them in sequence, and if you can do them at least 1 time a day, every single day. Now, that first release technique is going to be to the bottom of the foot. For this, I'm going to be using half of a neuro ball. If you do not have a neuro ball, you could use a lacrosse ball, a golf ball, or any other foot release tool that you may have. And what we want to do is we want to find 5 points on the foot that we want to hold pressure on for at least 30 seconds. So those 5 points, I typically recommend starting at the base of the heel, going into the middle of the arch, the ball of the foot, all the way to the outside, and then across towards the inside. So I'm going to start by placing the ball down on the floor, and I'm going to place my body weight into the first position, which is just in front of my heel. I'm going to stay here, and I'm going to hang out here for 30 seconds. Now, for all 5 of these points on both of our feet, you could of course do this on both feet, not just the symptomatic side. You want to stay here, nice and relaxed and breathing. After 30 seconds in position 1, we're then going to go to position number 2, and we're going to hold here. Again, nice and relaxed, holding there for 30 seconds. I'm gonna go to position 3, which is the ball of the foot. Your plantar fascia actually runs across the entire arch of the foot and inserts into the base of the toes. So by doing a release at the forefoot or the ball of the foot, you're also getting a really good plantar fascial release. After 30 seconds here, I'm gonna go all the way to the outside of my foot. This is gonna be position number 4. And then position number 5 is going to be on the inside. So we got 5 points in the bottom of the foot. We're doing for sure the side that has the heel pain, but you can of course do this on both sides. And you are using something like a golf ball, neuro ball, or lacrosse ball, holding 30 seconds per point. Now, after we do this trigger point release to the bottom of the foot, we're going to follow that immediately with your mobilization number 2. This is going to be a plantar fascial stretch. Now, there's 2 ways that you could do this. First one is you could have a seat in a chair, and then you're going to take your foot, make sure that you are flexing that ankle, and then I'm going to extend my toes back. Of course, you want to do this to all toes, but you really want to be focusing on that big toe as well. This is going to start to place a stretch into the bottom of the heel into that plantar fascia. And then I would hold here for approximately 30 seconds to a minute, and then you can relax, and we'll do another round of it. You're just holding here. Now, it might not feel like that much of a stretch is happening, but you do want to make sure that you are focusing on that area. Now, the second way that you could do this, if you don't want to do it in a seated position, is you could put your foot against something. So I'm going to do it on the side of this table, and I'm going to prop my toe up onto the side of the table, and then that is mimicking that same sort of stretch. I could bend my knee to get a little bit deeper stretch. Again, holding 30 seconds to a minute, get that nice stretch to the plantar fascia, and then we're going to release. So that's your second mobilization. Your third mobilization is going to be a release to the calf muscles. For this, I'm going to be using a rod or a stick. Now, you could use a foam roller, a lacrosse ball, any sort of release technique that you are familiar with or that you might have at home. But again, for the sake of this video, I'm going to be using a stick. I'm going to place the stick behind my soleus, which is the lower part of my calf, and I'm holding here, and I'm just doing a nice release and a massage. If I want to do more of like a pinpoint pressure or a cross friction, I'm actually going to change my grip. So I'm here, and then I'm doing a movement like this with my hands. Or I can move my ankle while holding pressure on the soleus muscle. But again, we're doing some sort of release to the soleus muscle. Make sure you get all aspects of it. So right now I'm a little bit more on the lateral aspect, and then I'm on the inside towards the medial aspect. So we're focusing lower leg, soleus muscle, getting some nice release with either a rod, massage tool, foam roller, etc. Now, immediately after doing the calf release, we're going to go into our fourth mobilization, which is actually going to be a little bit higher up from our foot. So you might be surprised that I'm recommending this. I'm going to take my neural ball and I'm going to make it into a full ball. So you want to have something that is like a lacrosse ball. This is a neural ball, a tennis ball, something similar size, and you actually want it to be quite dense. I'm then going to release into my pelvic floor. So for this, you want to be seated in a chair. I'm going to take my right hand and I'm going to find where my sits bones are, or my ischial tuberosity. I'm going to take the ball and I'm going to put it right just inside my ischial tuberosity. And as I'm sitting here, I'm going to start to feel this release to my pelvic floor and the ligaments that are at the base of the pelvis. Now, why this is connected into the plantar fascia and to your foot health is because our feet are actually connected to our pelvic floor. So by getting a release, not just literally at the foot, but higher up into the pelvis, can oftentimes take stress off of the foot as well. So we're going to hang out here for 30 seconds, and then we're going to move our body forward and to the right. So now I'm actually in another position on my pelvic floor or on this ligament. Hang out here for 30 seconds, and then one more time we're going to go forward and to the right. And now I'm just next to my tailbone. You don't want to be on the tailbone, but just next to the tailbone. And I'm hanging out here for 30 seconds, and then we of course want to repeat this on both sides. After I do that pelvic floor mobilization, we're then going to stand back up and we're going to open up the front of our hip, which is our hip flexors. So for here, I'm going to bring one leg forward, my other leg back, and the key here to getting a good mobilization is in the pelvis. So I'm scooping my pelvis under. I'm going to drop down into my hips, so I start to focus right here. Now, to deepen that stretch or that mobilization to the front of the hip, you want to keep tucking the pelvis under. I'm going to keep my chest tall, and then I'm going to bring my chin to my chest. So this is the first way that I can increase the intensity. Second way is that I can bring my head back up. I'm still tucking my pelvis under, and then I'm going to raise my arm up and reach to the sky to lengthen into that hip flexor. We want to hold here for approximately 30 seconds to a minute, and then we release, and then we repeat that. Again, you can of course do both sides to make sure that we are getting a good balanced reset. So to recap, those 5 mobilization techniques are going to be the bottom of the foot, getting into the plantar fascia by bending the toes back, getting into our calves, specifically the soleus muscle, and then we work our way up and we're going to release the pelvic floor and then open up the front of our hip. If you do these 5 mobilization exercises in sequence, you can think of it like your 15-minute reset for your plantar fasciitis or your plantar heel pain. Remember to do it every single day, at least 1 time a day. And to get even better results, look at the power of systemic enzymes such as Step Strong to help you to support the body's natural defense against inflammation and chronic tissue injury. To learn more about Step Strong, please visit stepstrong.com. To learn more about how I treat patients, please visit dremilysplickel.com.